everybody knows what metal braces are. Clear braces are commonly mistaken for many different things.
Right.
Generally clear braces are the same as metal braces, but they're
Okay.
just made out of porcelain, so they're tooth colored.
Okay.
And they work the same way braces do.
Yeah.
Invisalign, or clear aligners, is a little bit different. It's totally different. It's
Yeah.
actually it's clear plastic trays that fit over the teeth,
Okay.
and every week to 2 weeks they're changed. As you change through the trays, through 20, 30, 40, 50 of them, your teeth are slowly moving with every single new set. And it's an amazing process where, the orthodontist will, take an impression, we'll get a digital copy of the
Right.
teeth, and we're moving the teeth on a computer to their perfect position relative to, your face, your jaws, relative for the right age,
Right.
just to make everything to the ideal. And then we break down that movement from start to finish into these tiny little steps. And those tiny little steps are the trays that you
Yeah.
wear.
Yeah.
So the clear trays are clear. They just fit over your teeth. You have to take them in and out yourself. They have to be in 22 out of 24 hours.
Yes.
So essentially they're only out if you're eating or brushing your teeth.
Yes. Yeah.
And, we find a lot of patients like it
Yeah.
because they really can do everything that they've always done with their teeth. They can eat the food that they want. They can brush and floss as they please.
Right.
A lot of the tedious aspects of having braces kind of get
Right.
removed with it.
Yes. Yes, we do Invisalign as well. But I noticed that it is an advantage, especially with those patients when it comes to eating, or they don't have to avoid certain foods, or they can kind of, like you said, go about their day and no one really notices. So if you're
Exactly.
kind of like in a corporate industry business where you can't have braces, I mean, it's
The best are brides to be.
Yeah.
Because it's really important for them where, by the time they do their wedding photos or engagement
Yeah.
photos, they really can just take out their aligners, do their photos, put it back in. It's like nothing happened.
Yeah, awesome. Speaking about Invisalign, what type of cases can you do with it? Are you doing more complex cases with it?
Generally, the types of patients that can be seen for Invisalign will vary between office and office,
Okay.
and between orthodontists or dentists, depending on how they feel it works best in their hands. We're proud that our practice, Abraham Orthodontics, is ranked second in all of Windsor, Essex, Chatham,
Awesome.
and even into London in terms of experience
Yeah,
with it.
congrats.
So we see quite a bit, and it's not uncommon for patients to come to see us for, another opinion about it. And generally, we are really treating things almost apples to apples with braces compared to Invisalign. There's
Awesome.
still some minor things where, braces might be more beneficial.
Yeah,
But for example, right now, we're even doing some surgical cases with Invisalign.
awesome. That's awesome. How do you book an appointment?
So there's really two ways. So one, patients can ask for a referral from their family dentist at their next visit, and that's
Okay.
traditionally most commonly done. Alternatively, as we've said, we don't need a referral to see an orthodontist. So they can contact us directly, either on our social media pages, which we're very active on,
Yeah.
or even just simply calling the office to schedule an appointment. We offer free exams where on that first visit, we're looking at everything and we're
Okay.
giving all the information that the family needs in order to make a decision if treatment is needed or
Okay.
if they want it.
Okay. If someone needs a filling or a cleaning, can they start treatment right away?
Definitely not.
Okay.
It's really important that the whole foundation of the teeth are healthy before we start. So even if patients do seek us out on their own and we do our exam, we still go on the back end and check with their family dentist to make sure
Yeah.
that everything's up to date.
Yeah.
And if it's not, we really need to make sure that everything is taken care of before we actively start treatment. And the reason for that is, even some things like a very small filling or something that really might be able to hold off for some time, moving those teeth around that are slightly infected
Yeah.
can really trigger a huge response that can put, the patient and their teeth in a worse position than when they
Right.
started.
Yeah. So essentially, you want to start with a good foundation, And how often do you recommend cleanings more often with the orthodontics? Or
Well, that's the important part. So a specialist, even though we were dentists first, we don't replace the family dentist. So
Right.
while they're in treatment, all of our patients need to see their family dentist every 6 to 9 months for their cleanings
Yep.
and checkups. And, I think that's a very important part for treatment to be on time, and as smooth as possible.
Okay. Okay, awesome.